Good afternoon, ladies and gentlemen. Welcome to another edition of Ars Boni. It's my pleasure to introduce Karolina Plescher and Fabian Kalleutner from the University of Vienna to you today. I will briefly give you an orientation about their background in a second. Just let me introduce first the reason why I was considering to invite them, and they were polite enough to accept this invitation. The context in which this is happening today is a publication that Karolina and Fabian and a third member of the team, Anna Lia Brunetti, published on a blog about trust. I read it first in German and then in English. In German, the title is Vertrauen in die österreichische Bundesregierung und in das Gesundheitssystem während der COVID-19-Pandemie. So roughly in English, trust in the Austrian government and in the health and in the Austrian health system during the COVID-19 pandemics. That's a publication that was brought online via the center, the Vienna Center for Electoral Research, which is a research unit under the organizational capacity of the University of Vienna. And that was the reason why I invited them, because there's plenty of very interesting information about how trust is related to developments in the political system, but of course also in the health-related and public health-related development of this disease. The two speakers who were so kind to come today are in alphabetical order. Fabian Kalleutner. Fabian studied political science and history at the University of Vienna. He then switched to sociology and started the master program at the University of Vienna. And in addition, he follows a master program in history with a focus on economic and social history. His master thesis in sociology deals with the understanding of income taxes in Austria and its impact on opinions on state and society. Besides his study, he worked for 3 years as a student assistant at the Department of Political Science. The organizational infrastructure in which he is mainly working at the moment is the Department of Economic Sociology, if I'm not mistaken. The second speaker is Karolina Plescher, who is from the Department of Government. Karolina worked before joining the Department of Government as an assistant professor with tenure track at the University of Bologna and as a fellow of the Hertha Firnberg Foundation at the University of Vienna on a project on the consequences of coalition government compromise on public opinion. She completed her PhD at Trinity College in Dublin in 2013 with a dissertation on electoral behavior under mixed electoral systems under the supervision of Professor Michael March and Kenneth Benoit, and her PhD dissertation has been awarded with the ECPR Jean Blodel PhD Prize for the best thesis in politics in 2014. She got involved together with Silvia Kritzinger, who was already one of the guests of this series here. So she got involved with Professor Silvia Kritzinger in the H2020 project Reconnect, which is a project that studies citizens' perceptions of democracy and the rule of law in the EU and possible scenarios of reform. She has been awarded, that's really worth being mentioned, she has been awarded with an ERC starting grant, which is for the non-members of the scientific arena a huge success, because it's a very, very competitive prize. So she has been awarded with an ERC starting grant to examine the meanings of votings for ordinary citizens, their causes and consequences, a project that started in January 2021. On both speakers, there's plenty of information available on the web, also on the center, this Vienna Center for Electoral Research. However, if you don't mind, I would like to start here by asking you what exactly this center is, what your involvement into this center means, and in how far the publication we are talking about is connected with the center.
Shall I start, Fabian?
If you wish,
okay?
Of course, yeah.
So Fabian, just jump in whenever you feel like to. So the Vienna Center for Electoral Research is an interdisciplinary center which is hosted by the Department of Government at the University of Vienna, but sees the collaboration from several other departments, more notably the Department of Political Science, the Department of Communication, and also the Economic Sociology Department, and so has several PIs leading a series of postdocs and PhDs, and is mainly interested, among other things, but mainly about conducting surveys to measure public opinion and changes in public opinion, mainly in Austria, but sometimes we also engage in international projects, so outside Austria, to see also Austria in comparison with other countries. And the data and the graphs will show us today, it's data collected by the Vienna Center for Electoral Research, but within the Austrian Corona Panel project, which is a special program that we set up to follow public opinion over weeks and months during the pandemic. It started in March 2020 and it's still ongoing. It's among the very few actually types of data collection like this that exist in the entire world, where we are able to follow the population over time. And actually we're very proud of this because it's one of the few in Europe. And some of the data we'll show you today are based on the Austrian Corona Panel project.
Mm-hmm. So this is still ongoing. Is there any end date set, or is this, I mean, is the end date the end of the pandemic?
I mean, if I jump in here, I would say that the end is not set yet, but the end would be, of course, a very pragmatic one if we run out of money, because every survey wave costs money. So if we have enough funding, we have enough funding until about this summer. So we got an FWF grant last year, was quite good, because we already got funding from the University of Vienna and afterwards from the Chamber of Labor and the Industriellenvereinigung, and also of the Vienna Technological Fund. I remember the correct abbreviation here, but so it is ongoing. We have now switched from a weekly survey waves at the start of the pandemic in late of March. So we had every week one wave for 10 weeks. Then we had a bi-weekly survey waves, and now we have monthly waves. And we are ongoing at least until this summer, but hopefully longer.
So it's probably a rather difficult task, because you need to secure the funding in parallel to doing the research, right? So it's yeah, the typical problem in a way, right? So yeah, okay. So then let's have a look into the data, if you don't mind. Carolina, could I ask you to give us an overview about what the outcome is, the main outcomes are? And would you like to share your screen for this purpose?
Yes, I will share the screen.
This is one of the most heard sentences in this whole pandemic. Yeah, would you like to share your screen? Right? It's,
a lot of memes about that already. Yeah.
Yes,
but it works. Perfect.
Okay, so because I was just about to say the next most common question is, do you see it?
See it? Yes, we do.
Very good. Yeah. So I will just give a brief introduction of what we did here. Our question was, how does trust in government, in the Austrian federal government, and trust in the health authorities has evolved over time since more or less the beginning of the pandemic in March 2020 up to February right now, but we will continue, as I said, to monitor this. And this question is important for us because what we know also from the existing literature and existing studies is that when an international crisis hits a country, there is a sudden increase in trust for internal actors, such as the government. And this is because citizens feel the need to trust the national level authorities to take action to protect them from the health threat and the economic threat that the international crisis poses. And we know that at the beginning we should observe a huge jump in trusting government. So more and more people should trust the government. But then still the question is, how does trust evolve over time? Because we know that this trust is very important. And why is that important? Is because when the government enjoys a large support from the population in terms of trust. So trust is widespread in the society. The government can be more confident and more reliable, can rely on the support of the population for compliance in those important measures that the government needs to, life-saving measures that the government needs to implement for the crisis. If there is not this trust, the government will have a hard time assuring the compliance from the population. And so when we observe this positive change in trust, usually this is welcomed by the government authorities, but also in general, because it will improve compliance. And we do observe this in Austria as well. What you see at the very beginning, so in March 2020, you see that a large majority of the population trusts the government. The level is very high. And this is observed in many other countries as well, not in all countries equally, but in those countries where especially the polarization in the society is not very high, this is a natural sort of like outcome of the international crisis. And you see this in March, but this continues for let's say a couple of weeks, but already towards May or so, there is a short or a sudden decrease in the level of trust for the government, but not much. If you see, the blue colors are basically the percentage of the populations that is very much in trust or trusts the government. So trust remains quite high also during the summer, but already if you see June, July, or August, already the share of people who are more critical, and there is a decline in trust in the government. So the red and the orange color of the graph starts to increase over time, until the decline in trust continues over time until we see more recently a sharp decline in this trust. And of course, the question is why this happens. Yeah, so why we know that it's very normal to see this jump in trust in the beginning, but why does it decline if the pandemic continues? We would expect this to continue over time, but we don't see this. And there are a couple of reasons why this can happen, and we can discuss about this also later. But some of the responsibility, of course, is also homemade in terms of how the government is how the government is effective in dealing with the crisis, etc. But Fabian, do you want to add anything on this graph?
I mean, just one thing, you already mentioned that it was very high at the beginning. We also know that it was very high at the beginning because Carolina as well and others were part of the Austrian national election study that took place before the pandemic. So we have a pre-pandemic measure. And if I would have to compare it to the trust levels in this graph, it would be around September or October that we reached pre-crisis levels. So you really see the huge effect that this boost in trust had at the beginning of the crisis. So it is now quite much lower than at the start of the crisis, but it's not extremely lower than before the crisis started. So because we are only have data around 2 weeks after the first lockdown. So we have to mention that.
May I ask questions already here, or should we continue?
No, please.
Okay. So the first question I would have is what exactly is the question about trust? So do you ask the people responding simply, vertrauen Sie der Regierung, or is it a more complex question? And the second question, no, there are several more. The second question would be, Do you think that the respondents make a distinction between the government and the political system as a whole? So is it really the government we are talking about here? And the third question would be, how different is this outcome from other European countries? So is this specific in any way, or is it very similar everywhere?
Fabian, do you want to start with the question?
I can start with the question. I have the question wording here. So we do not only ask about the government, so we ask about several important institutions. Mm-hmm. And the question wording would be, and I just cite from our questionnaire, if you look at the list below, do you have much, some, little or no trust in each of the institutions mentioned in the context of the corona crisis? And then we ask about the public television, the police, parliament, and the federal government, among others.
Okay, and not regional governments in comparison. So, for example, in Vienna, it would not be that I would need to answer on Vienna's government and the federal government in comparison.
We included this question, but not every time. So we had, I think, 3 waves or something that included the local governments as well. Okay,
I see.
But we specify here that this is specifically just for the federal government. Mm-hmm. And so their judgment is for the federal government.
I see. Okay. And is Austria typical in this, or is it very different from the other European countries?
When it pertains to the jump in trust that you observe at the beginning of the crisis, this is typical of many other countries around the world. We have observed this in Australia, Italy, Great Britain, etc. In many countries, there is this jump. Also, for instance, in the US and many other countries. How big this increase is, of course, depends on each single country. Actually, I can show you. I have this. This is however, is not trust in government, but approval for specific leaders. And you see here at the very beginning, this is basically showing you the change in leaders' approval. From the moment the WHO has declared the COVID-19 a pandemic up to about the end of April. And what you observe is that in the very beginning, there is for almost every leader considered here, so Morrison in Australia, Trudeau in Canada, etc., a jump in the approval. And this is more or less what happens if you ask for trust in government, so a huge increase. However, after this jump, here, countries have taken a different trajectories in terms of whether there has been a huge increase, a slightly increase, or for Trump, for instance, has remained more or less similar over time. And there is even a decrease for Abe in Japan and Bolsonaro in Brazil. And this is mostly due to the polarization that the different society have. You know, if there is a lot of polarization in the society, meaning that groups of citizens are split up in terms of party preferences, then the oppositions will not so much rally around the government and the government authorities or the government leaders. And if you would see Austria here, it would follow more or less the trajectories that, for instance, we observe for Merkel, but also so upper here, basically. We don't, this is from The Economist, it doesn't include Austria, but is rather similar. What we don't know about so much about the other countries is basically what we can do with the Austrian Corona Panel project, which is a much more long-term perspective, because these data are very rare.
So we don't know. The second part of the question is unknown then, in a way.
The second part is that you expect a little bit of a decline. Yeah. The decline of trust, it's almost a part of the story, because keeping it so high is very difficult. So we expect to see a decline in other countries as well. How much is there a decline? It's hard to say without data. And will depend a little bit also on how the pandemic has been evolving in the different country situations. But what you observe here, especially during the summer, is very similar in other countries as well.
I see.
Yeah. So what's interesting here is also that There was these stories about why is this jump? I mean, not why is this jump because of Corona is an easy answer, but is it because the infection numbers are rising, so people are simply afraid of everything and flock to the government or to the states to provide them with security or something like that? Or is it because of the very severe measures that have been taken, so the lockdown itself? There is some evidence right now, and I think also this, especially if you look at the second half where we had the second wave and surge of infection rates in Austria, it cannot be simply the infection numbers and it cannot be simply the lockdown, because we had many lockdowns, we had a much more increase in infection numbers. So it's it is not the case that simply danger or a threat of COVID-19 increases this distrust. So,
but so is there any way to interpret this then? So do you have any additional data what it might be if it's not the threat?
Yeah, so we did some additional analysis to find out what is associated with trust and with changes in trust. And what we have found that, first of all, the health and economic threat are among the most important variable at the beginning of the crisis. So the more people feel a threat of health or economic type of threat from the pandemic, the more they trust the government. And so a decline in the threat perception that we have experienced, especially during the summer, where with the lockdown, easing of the mask rules, etc. So the decline in health and economic threat brings down the high level of trust in government. But also what seems to be incredibly important in explaining this decline in trust are party preferences. Because the moment the crisis continues, but to some extent the health and the economic threat tend to diminish a little bit, because for a series of reasons, the supporters of the oppositions tend to retreat from trusting the government anymore. So there is again this political sort of like machines get in action again, where people and that like more other parties than the parties in government will tend to be less trustful of the government itself. So basically what you observe if the international crisis is not present in a country, what you observe, of course, is that if I like a specific party, I also like to trust that party more. And so as the pandemic continues, party preferences becomes incredibly more important, and opposition party supporters tend to lose trust in government. And this is by far the most important variable we have found. So no much differences in terms of like age, gender, or education. From the social demographic point of view, not much makes a difference in terms of decline in trust. It's really about political preferences, the opposition that starts to criticize the government, and so their supporters will follow them, basically.
But if I understood Fabian correctly before, he said that the outcome of all this was that in September or so, it was back to the status where it was before the crisis started, which means that the situation at the moment from a government's perspective is worse than it was before the crisis. Correct? If this is correct, how can it then be that the very few data that I know about electoral preferences and what people would vote for if there were votes or elections next week very much looked like before the crisis? So is this, or is this assumption wrong? Or am I wrong in the assumption or in the data? Or is it unclear?
No, you're not wrong. It's just that there is also a bit of a difference between trusting the government and voting for specific parties. Because even if you might lose a bit of trust in the government, it's still possible that the parties in government are the ones you would vote for, because you don't jump simply because of this to another party immediately. So you can see a little bit of a disconnection in terms of electoral preferences and trust in government. If it's in the long term, trust declines even more, it's possible that some people will change their mind also in terms of electoral preferences.
Okay. So, and then how is it possible to interpret in how far competence or the feeling that someone is competent for the problem has an impact on trust? So would it, I mean, this is one of the things that one reads about Merkel, for example, that people tend to follow her guidance more because people think that she's more competent, which might have the reason that she has a background in science, whereas other politicians in Europe don't have such a background. Do you know anything about that, or is it possible to know anything about that?
I mean, I would say it is difficult to say specifically whether this is a main mechanism for the change, but we can observe that we also ask people about whether they think how effective current measures are now to really compete against the virus. So get down the infection numbers, for example. Yeah, and we see from quite similarly from the summer onwards, from the start of this kind of slow start of the second wave onwards, that people more and more lose the perception that the government is able to deal with the crisis. So it is really in line with this decrease in trust levels. But of course, this is a comparison of averages right now. I have no more data, so we really would have to look whether this correlation is really related also causally or quasi-causally with the decrease in the perceived effectiveness of the measures.
And the debate about the delay, in some people's opinion, delays in the vaccination campaign are not yet in this data, right? Because this is to be seen in a more recent data set, probably not yet here. So we will see how whether this will have an impact, or do you know already something about this?
I mean, this has started, I think, in January. So we see a little decrease also from then onwards. So it is, the trust in the government is decreasing, but also that we now see a little tiny decrease in the trust in the health system. So I think this is a point that should be raised, that now also other institutions might get in danger, and this more non-political in the eye of the respondent institutions like the police or the health system now also have slowly decreasing trust.
Okay, yeah. Sorry, Carolina, I didn't want to interrupt you so long. Sorry. You rightly should continue. I'm sorry.
No,
you already
no
put the slide. You already put the next slide on this.
Fabian was already mentioning the Austria health system, and so I wanted to share the graph. But no, feel free to.
No, but if you don't mind, just one last question for this. Please. If you don't mind, then go back to the other slide, because there is, if I see correctly, there is a quite significant jump between December and January, with 22% then, so 1/3 more if you take it from December, absolutely not trusting the government. So the dark red box, and I'm trying to understand whether this is an artifact or whether something happened there, and if so, what it could have been. And do you know this, or do you have a speculation about this, or a guess, or would it be possible that this is the vaccination issue?
Yes, the vaccination is possibly an issue. Also, the delay and the slow implementation of the vaccination, but also what happened during Christmas, especially where a series of measures, so opening the ski lift, etc. So these were a little bit controversial. You saw in the population, some people really wanted to go skiing, and another part of the population who said, well, it's not really the moment to open up the ski facility. So not only in Austria, we saw this discussion in Italy, in Switzerland, and other countries as well. So the population was split in terms of these measures, and I think that's why we observed the jump there. It's both the vaccine slowness. In the beginning, was not even sure if this was, for instance, compulsory, not compulsory. There was a bit of discussion, and then all the controversial measures in December, I think, played a role there as well.
Yeah, I completely agree with that. Especially, we have another question that asks, and I think this is really one of the most interesting questions we have, whether people think that the current levels, the strictness of the current measures against COVID are right, are too strict, or are not strict enough. And what we see from the start, with around 70 or even more people who said that these are the measures that are right now for this crisis. And now we have about 30%. So it really, so the people who think that these measures right now are the perfect measures really decreased, and both ends increased. So we have a polarization, a strong polarization. For some people, they say that we have to enact more strict measures, so a strong lockdown to get the infection numbers down, and then we can live on happily after. And there's a similar in size group that says, no, we are much too strict, we have to decrease the strictness right now. So really also the government has a problem here, because you have this two groups, and they are similarly incomparable. So you cannot do right for both. And these two groups get stronger and stronger, it seems.
But you don't have this problem only in the government, you also have it in some of the parties, right? So I mean, this is at least what some people write about the Social Democrats, that there are both positions quite prominently represented in the SPÖ at the moment. One group arguing that the lockdown should continue and should even be tighter, and others arguing that we need a looser situation. So it's not only the government, I would assume, and probably it's all of us in a way, right? It's yeah. Okay. Thank you. Carolina, would you like to proceed with the health system, or?
Yeah, so the question we asked in our blog, or what we were interested in, is like, if there is this massive decline in trust in the federal government, do we see this trust being transferred to other internal actors and internal authorities? And obviously, to our mind came the health system, because it's the one that is playing a primary role in the crisis. And as you can see also from the graph, actually the trust in the Austrian health system among the respondents of our survey is relatively high, especially if you tend to compare it to other countries. So it's rather high. But if anything, over time, you don't see an increase in trust, so the bluish boxes in the graph. But if anything, you actually see a decline in trust also for the Austrian health system, not so much at the beginning and during the summer, which has remained, I should say, more or less unchanged over time, but November and December, that has been, or notably starting with a decline in trust also for the Austrian health system, which we know that we did not expect, but we were at the beginning a little bit puzzled by this. Because as we said as I said a moment ago, if we said, okay, maybe the trust will be transferred to the Austrian health system, but that's not the case. And again, one can speculate why might be the case.
And how is the health system doing here in comparison with other institutions such as police or public broadcasting? Or so is it still doing better, or is this now more or less the average situation to other institutions apart from the government?
I think it is always a little bit difficult to compare the absolute values, because the starting points are very much different. But if you compare again the directory, so from the start of the panel on March till now, we see comparatively similar trajectories. For the police, for example, maybe a little bit more decreasing, but quite similar. And we see similar to the government trajectories for the parliament, and also just a little bit lesser degree for the public broadcasters, for the ORF, which is quite interesting as well, I think. But I'm not that much of an expert in communication science, but I think that this is also quite interesting that the ORF also quite lost in the trust levels during the pandemic.
Is there any institution that won, so where the trust is higher now than it was before the crisis, or is everybody losing?
So I do not know of any of the 6 or 7 we are asking every wave. So I did not look at some specific one, like science, for example. We also asked sometimes about how people trust science. But I have to admit I didn't look at I don't have the numbers.
But the institutions we looked at were all, if anything, there was a little decline in trust rather than an increase. It's hard to make a comparison to the situation, so the pre-COVID situation, because we didn't have the data also in February and January, so before the pandemic, for several of these institutions. But in general, you see a decline in trust, which maybe also speaks towards the fact that this pandemic is going on for a long time, and people might be just very generally a little bit retrieving in themselves, far away from the institutions, which is of course not it's not good news, in general, I think. Because those institutions are at very basis for like compliance with the measures, also for compliance with laws, etc. So obviously this is can be problematic over time.
Yeah. By the way, is it possible to draw some kind of conclusion out of the loss in trust, in the sense that people will probably follow the legal rules less, so that compliance will decrease? Would that be a valid argument? And is this somewhere, is it possible to ask such a question? And do you find it in the data? Or would that be speculation?
Well, the general expectation is that the more you trust a specific authority, the more you're willing to follow the rules that that authority asks you to follow. And so in general, if trust declines, the compliance might decline. Whether this will happen in the context of the pandemic is, of course, an important question and a crucial one, especially if we don't get out of the pandemic very soon. And so compliance will be needed for the weeks and months to come. But there is a strong correlation between trust and compliance. So I think this implication that you are drawing is quite correct.
We also we have studied one quite concrete measure, namely we asked people about also their behavior. So we can follow how much did people in several points in these waves did think that they, so self-reported of course, wear masks, keep distance to others, and stay at home. So we have this on several points here. And we measured how much trust or changes in trust between waves affects changes in these preventive measures. And we see that this has an effect. So if people are more decreasing in trust, because nearly everybody decreases their trust level, but if the trust levels increase more, then they also are more likely to decrease their preventive behaviors. So it has an effect. And it has an especially strong effect because we also tested moderation effects if risk levels are decreasing. So it might especially have an effect now when vaccinations start to increase and people might have the feeling that the risk levels for society are decreasing, that then the compliance will even more likely to be declining, because risk levels are this other compliance bringer. So if you think that yourself and especially others, so it's not only about your risk, it's also about risks of your friends and the elderly and stuff like that. So it's not only your personal risk, but if these two risks, your personal risks and the social risk perception are decreasing, then trust in government becomes more important for the compliance.
Which means that all these movements simply denying the disease or the severity of the disease are a double problem for the government then, because it probably increases the amount of people who don't see the risk anymore, right? And if at the same time the trust into the government is connected with this and is decreasing, the crisis from the government's perspective is getting even more severe, right? So this might be something I would, if I were in the government, monitor very closely then.
Yeah, I think so. Yeah.
And do you ask anything about specific institutions such as, for example, the judicial system? Is there, because this is, as you know, at the moment in Austria, quite on the agenda every day. And it's interestingly connected with the COVID debate in a way, in some ways, sometime. So is this one of the questions you are asking, or is the judicial system out of your scope?
This was also one of them that we asked, I think, 2 times, but I don't have the numbers.
Okay.
I'm
So
sorry,
it would be interesting to see how whether there's any relationship between the trust into the government and sorry.
I think back then I did not see a very strong change. So I think they were quite similar to the police, for example, and the health system. Because people relate the justice systems more towards this unpolitical than the political side, but especially because of the recent discussions, this might change right now. That's true.
Yeah. May I perhaps ask you both about the perception of these data? So you are obviously in the academic system, so you are doing this research and then you are presenting it. Was there any response from the political arena on this? Or is somebody asking you for your advice, what to do now in the next weeks and months to come in order to keep trust high and to keep compliance high? Or is this completely separated from the day-to-day political discussions?
Well, we are we write weekly blogs, and with these blogs, with especially the short blogs and the dynamic graphs, we hope to reach also beyond academia and talk to the society and to the political actors, and especially the PIs of the project. So Bernhard Kittel, Silvia Kritzinger, Hajo Baumgarten, and Barbara Preinsack, all professors at the University of Vienna, they are especially providing reports to the ministries and to other political actors when asked, especially based on the data we're discussing also today. So the idea actually of the Corona Panel project is to bridge the academia and the world outside academia, because it's probably one of the rare moments where our data becomes important also in societal terms.
And do you have the feeling, or would you like to comment on whether you are heard in the societal arena in a sufficient way, or would you see some room for improvement here? And more importantly, perhaps, would you change anything in the structure, how Austria works on the interconnection between the scientific data on the one hand and the political decision making on the other hand?
This is a difficult question, so I leave it to Fabian.
Yeah, of course. Yeah. No, I mean, what I would say, I would answer maybe a little bit like a politician. What I experienced right now is really, I think that this project is a very special one, because it's very interdisciplinary from every aspect of it. Because it also has question from political science, sociology, and we also have every month have these meetings online. I think from a scientific standpoint, this is a much needed move forward towards interdisciplinary research, and we've seen that, I think, in the COVID-19 pandemic. So I think that this direction might also need more institutional or institutionalized efforts afterwards, maybe to establish these projects from a long-term basis. For example, like these panels, there are other countries that have long established institutionalized panels that then lead into the pandemic, and they have better ways to compare before and afterwards. And we lacked it a little bit in Austria because there was no will or political will as well to establish a social survey that really measures every year, for example, how the Austrian population of a representative sample is thinking about societal issues. And I think the Corona Panel project is a way to say this is very important. We have many media reports as well of our blogs, for example, and this really has impact. Also, I think the politicians now see that a little bit more, that it is really difficult to see how people will act, and then social sciences can provide some evidence in that. And if this will happen, so if there is an institutionalizing process about really measuring empirically what people are thinking and then using that for science and for informing political decisions, that would be, I think, a good way forward.
Okay, I see. Okay, very last, probably not very nice question from my side, if I may, would be, if you were consulting the government at the moment, what would be your priority if you had identified this decline in trust as a problem? What would you advise that the government should take as countermeasures? Is there anything that you could scientifically provide as an advice here, or is it just our day-to-day average perception about what should or should not be done in the crisis?
Well, what is clear also from the data is that people appreciate transparency and knowing the decision and where the decisions come from. So an open and transparent process of also taking the decision. And this includes also talking to not only opposition parties, but also groups in the society. So take into account the need and especially the needs of societal groups, especially those who are suffering the most during the pandemic. And I think this is this is what people would appreciate the most in keeping high the trust and the feeling of competence towards the government. I know this is difficult also for the government to do during the pandemic, because sometimes you need to take decision very quickly. And of course, all the other problems within the government do not help in this regard. But transparency and incorporating the views from other political sides and the society is seen as extremely important by the population.
And do you think, or do you have any data whether it would be possible to reverse the development then, in the sense that trust could increase again? Or let's put the question differently, those 22% who clearly do not give any trust into the government anymore, is it possible to convince them again, or are they simply lost? Or unclear?
It's a difficult question, because when you say no trust at all, so you are not saying low trust, you're saying no trust at all. Those are people that are difficult to gain back, I would say. It's possible. I'm not saying that it's impossible, but it's really difficult. Like, you know, when this happens, it's really difficult, but not impossible. And I think you know, if the situations improves, maybe some of these people are happy to revert back to mild positions in terms of trust, but it's unlikely they will jump from not trust at all to very much trust the government now, I would say. I don't want to leave with a pessimistic thought, but it's just very difficult, I think, to win back.
And to make it not so pessimistic, I think this is also to some degree as well, like not 20%, but 10% or around that margin is also completely standard. So when we do not have, there are always some people who say that they do completely not trust the government, but this does not mean if we are approaching a failing state or something like that. But to some degree, this is also a very democratic process. There are some people who are quite in opposition to the performance and the directory of the government. And also this kind of highlights that the opposition now has really found kind of the ways to be an opposition again. I think it is difficult to think back on the March and April situation where there was this parliament and the opposition that had this kind of opposition problem, that they were also in favor of a lockdown because you don't know what to do, and you have to agree because the coronavirus, and so there was also no food, for example, to distrust the government, because also the opposition parties and everybody had this kind of directory that it was quite similar to the government. And now we have more clear distinction again. Whether this is a good position or not, that remains up to debate.
I see. Okay. Thank you very much, Carolina. Thank you very much, Fabian. Is there anything that you want to add that I should have asked you, something that is specifically important? Or did we cover your research sufficiently?
I think we covered all the most important points. I just want to thank you so much for the invitation. I think this was great, and also a great opportunity for us to also show you some of our data, and we can come back in future, and not for another pandemic, I hope, but to discuss how we got out of the pandemic. Perhaps.
Yeah. Wow, that's a very positive perspective. Yeah.
Thank
Fabian?
you very much. Yeah.
Okay.
Really, it's amazing, and also what you do with the podcast. I mean, this must be a lot of work, and I think thank you. Yeah.
It's a lot of fun. Thank you. Thank you. It's a lot of fun because of guests like you, believe me. And it's a terrific opportunity to learn a lot about the situation in which all of us are in at the moment. Thank you so much for coming. Thank you for you who are listening. Please stay connected with us, stay interested, and in particular, please stay healthy or become healthy as quickly as possible. All the best to all of you and have a nice weekend. Bye-bye.
Bye.
Bye.